Well, the federal government has finally declared a national state of emergency for monkeypox, and that is going to free up some resources and hopefully send some relief our way. Senator Scott Wiener joining us now. Thanks for being here. This is something you've been calling for weeks.
Well, yeah, we've been in an emergency for a while now, uh, and we need to really act like we're in an emergency. And this declaration by President Biden today will be helpful in opening up some resources, but also allowing for faster approval of medication, as well as new, better kinds of testing. So this will definitely be a good step in fighting this outbreak.
So we've been hearing about more vaccines coming our way. What is the status right now of how badly is the need outpacing the supply?
It is, we're desperate for more vaccines. We have a profound shortage. The San Francisco AIDS Foundation is maintaining a wait list for people who are wanting vaccines. It's massive. San Francisco keeps running out of vaccines, and then when we reopened the clinic, like this past Monday morning, it was reopened and there was a line, I think 4 blocks long. People are desperate to get vaccinated. And my worry is that as we continue to see some uptick in the amount of vaccine we get, the demand moves up even faster. More and more people become aware, and which is good, but we don't have enough supply.
Well, and then right in the meantime, the number of cases is multiplying. When it comes to the state and the federal response, is this too little, too late?
Um, it's never too late. It may be too late to control the outbreak, because remember, it's not just the U.S. It's numerous countries around the world with not enough vaccine in any of them. So it is spreading. It's not being effectively controlled at this point. It could become endemic here and elsewhere, meaning a regular virus that's just with us for the long run, which would be really tragic. But we may be heading in that direction, because I don't see enough vaccine supply coming quickly enough to truly stomp this out. But hope springs eternal, and we have to keep working very, very hard to get people vaccinated.
In the meantime, do you see any, shifts in society with this as people try to avoid it?
Yes, I think among gay men, we're definitely, seeing a lot of decisions. We want people to have information so we can all make decisions about what risk level we're willing to tolerate. This isn't like COVID, where someone has COVID, walk into a room with 20 people and infect half the people there just by breathing. It's not, fortunately, it's dramatically less contagious like that. It's about skin to skin contact. So this is really about people making personal choices about what risk they're willing to tolerate. The Dory Alley Street Fair there were still a lot of people there, but there were fewer people than normal. I walked through because I wanted to just, check things out and see what the community was up to and what people were saying. And people were generally, I think, a little more restrained than in previous years. I know people who were, someone who was working the door at one of the sex parties the weekend of Dory, and attendance was down by 50%. I've heard that about some of the other sex parties as well. So, I think we're doing the right thing. We shouldn't be shutting things down. That didn't work during the 80s with HIV. That's not a good public health strategy. But people make their own choices, and there are people who are being a little more restrained because they want to reduce their risk until they can get vaccinated, until other people can get vaccinated. And that's why we try to push information out.